Hi, my name is Ari Goldsmith. I am a pediatric otolaryngologist here in the division of otolaryngology at Maimonides Medical Center. I started medical school at Albert Einstein College of Medicine, then went on for residency in otolaryngology at Schneider Children's Hospital in Long Island Jewish Medical Center. After that, starting 93 to 95, I did a fellowship in pediatric otolaryngology at Boston Children's Hospital and the Harvard Medical School. And then after that, I started working. Otitis media, sinusitis, upper airway obstruction, operations such as tubes, tonsils, and adenoids. That is one aspect of my interest. On the other hand, I also have an interest in the most difficult part of pediatric otolaryngology, which is the pediatric airway reconstructions, children with tracheotomies that have developed narrowing and stenosis and need repair. So I kind of have a diurnal type of interest within the field. My interest subsequently in pediatric otolaryngology was, firstly, I think kids are great, and even parents are great, but also within pediatric otolaryngology, I can do any type of ENT procedure as long as it's on a child. So I can do all the varied type of procedures as long as it's in the pediatric age group. My treatment philosophy is very straightforward. I believe that there are definite answers to all problems. In other words, there's not a lot of back and forth, maybe this, maybe that, I don't know, maybe this. It's usually pretty straightforward. And what parents want to hear from the specialist they're seeing is, what does the specialist recommend? It's a much more efficient and effective way of seeing patients. And I think parents walk out much happier having heard a definite recommendation from the physician. When a kid walks into my office, every single kid that walks into that chair makes me smile and gives me another oomph to go see a patient. I never get bored. I never say, oh, how many patients are there left to see today? Are there 20? Are there 30? I walk in to see every kid, happy and excited to see them. So it really is that. I'm well trained and I love kids. I'm actually a pretty modest guy. But I've been lucky to have been recognized by New York Magazine for over 10 years as one of New York's best doctors. I've been recognized by Castle Connolly, America's top doctors, for over 10 years, and by New York Times Super Docs for every year since it started. Why they're special to me is that these are awards and commendations that are chosen by other physicians in my field. So it makes me feel good that other physicians in the field that I deal with feel that I'm good enough for them to send their family members to me. Maimonides does a remarkable job of dealing with suffering. If you go up to the pediatric floors and look in the child life room, you'll see sick kids that are literally spending the entire day playing in a room with child life specialists who do crazy things like quack like ducks and play guitar and things like that. In terms of the parents, the way you remove their suffering is to be honest with them and to tell them exactly what's going on. Be honest, be positive, but be honest. And I think that if you can do those two things, which here at Maimonides we really strive to do, I think you can really minimize the suffering and really, make people well in a good environment.